Thank you. A very good morning to each and every one of us. My name is Abigail Marshall-Cutting, and I am the chair for the Scrutiny Board for Adult Health and Active Lifestyle. At this point, I would like to clarify that while this meeting is being webcast live to enable public access, it is not being held as a public meeting in accordance with the Local Government Act of 1972. As such, it is a remote consultative meeting of the Adult Health and Active Lifestyle Scrutiny Board. The consultative status of today's meeting means that some of the usual formalities will not take place at the start of the meeting, and while it also means that the board will not be in a position to take any formal decisions, today's discussion will still very much inform the work of the Scrutiny Board, and where necessary, any proposed actions that do require formal ratification will be referred to the next formal public meeting of the Scrutiny Board for approval. So I would like to now invite members of the board to introduce themselves in the following alphabetical order. Councillor Anderson.
Good morning, everybody. I'm Councillor Caroline Anderson. I represent Adlam Wharfdale Ward. Thank you.
Thanks for coming. Dr. Beale.
Good morning. I'm John Beale. I'm Chair of Health Watch Leeds, and I'm a co-option member of this board.
Thanks for coming. We've also received apologies from Councillor Cunningham. Is Councillor Dowson here yet? All right, next, Councillor Gibson.
Good morning, everyone. Councillor James Gibson, Crossgates and Winmore Ward.
Thanks for coming. Councillor Harrington.
Morning, everybody. Norma Harrington from Wetherby Ward.
Thanks for coming. Councillor Hatbrook here yet? Okay. Councillor Iqbal.
Mohammed Iqbal, Hunslet Riverside Ward.
Thanks for coming. Councillor Kidger here yet? Okay. Councillor Latty.
Good morning. Councillor Graham Latty, Guiseley and Rawdon Ward.
Thanks for coming. Finally, Councillor Taylor.
Good morning. Councillor Taylor from Chapel Allerton Ward.
Thanks for coming. I would now like to invite the board's principal scrutiny advisor to introduce herself at this point.
Good morning, everybody. I'm Angela Brogden, the principal scrutiny advisor.
Thank you, Angela, and thanks for all your hard work. Right, moving on straight to agenda item number 1, declaration of interest. Can I now invite members to declare any disclosable pecuniary or any other interest? Okay, thank you very much. Agenda item number 2 is the update on the development of the local integrated care system. So board, since July last year, this Scrutiny Board has continued to monitor the ongoing development of the new integrated care system. It is now anticipated that from 1st July 2022, ICS will be put onto a statutory footing and comprise an integrated care partnership and an integrated care board. Back in November, the West Yorkshire Health and Care Partnership had published a draft constitution of the West Yorkshire Integrated Care Board for consultation. As a Scrutiny Board, we used our January meeting to consider and provide feedback on the draft constitution, and our main points were reflected in a letter to the Chief Executive of the partnership. A copy of this letter can be found on page 6 of the agenda pack, which all of you should have. The purpose of today's meeting is to receive a further update surrounding the development of the local ICS, including details of changes made to the West Yorkshire ICB Constitution in light of the broader consultation feedback. A briefing note has therefore been provided by the Leeds NHS Clinical Commissioning Group, which sets out the latest position regarding the draft ICB Constitution and Leeds place-based governance arrangements. I will now invite participants to introduce themselves, and I will start with Councillor Venner.
Hi everyone, I'm Councillor Fiona Venner. I'm the Executive Board Member for Children and Adult Social Care and Health Partnerships, and the Health Partnership bit is about the Council's interface with the NHS, and in that part of my portfolio I chair the Health and Wellbeing Board. Thank you.
Thank you very much, Councillor, for joining us. Councillor Arif?
Hi everybody, good morning. I'm Councillor Salma Arif. I'm the Executive Board Member for Public Health and Active Lifestyles. Thank you.
Thank you, Councillor, for joining us. Kath?
Good morning, Kath Roth, Director of Adults and Health for Leeds City Council.
Thank you for joining us. Victoria?
Good morning, everyone. Victoria Eaton, Director of Public Health for Leeds.
Thank you very much. Mr. Riley himself?
Hi everyone, thank you for giving me the opportunity to attend. Tim Riley, Chief Exec at Leeds CCG and Accountable Officer brackets Leeds designate in the new world from the 1st of July.
Thank you very much. Arfin?
Hello everyone, Arfin Hussain, Corporate Governance Officer at NHS Leeds CCG.
Thank you very much for joining us. Right, I will now invite Tim to introduce the briefing provided by the CCG for us. So over to you, Tim.
Yes, thank you very much again for the opportunity, and also thank you for the feedback this time. It's really useful to come and see all of you and talk through some of these issues and keep you abreast of the changes and the development as it goes ahead. I think it's probably, we'll all be aware that the bill is going through Parliament. Indeed, it's meant to complete going through Parliament by the end of this week. If it doesn't, then the 1st of July becomes a little bit of a problem, but the expectation is that it will go through. And therefore, the West Yorkshire Integrated Care Board will be established as a statutory body from the 1st of July. And the CCG in Leeds and indeed other CCGs across the country will effectively cease to exist from that date. So it's made progress. There have not been any significant changes in the legislative process, although I think some of the powers of the Secretary of State to intervene have been adjusted, shall we say, in terms of that bill. But once that's gone through, we will be at full steam ahead for the 1st of July, and we are expecting that to be, as I say, by the end of this week. In terms of the constitution of the ICS, because certainly we spent some time talking through that last time we came together in January, we've done further iterations, and that draft is now going forward as a sort of draft for NHS England to look at and have their lawyers check over and check it's all legal and sound. And that latest version, I think, is attached in your pack. It will then come back with any advice, and then as CCG chief officers across West Yorkshire, we will then have to formally propose the very final version. Is the way that the sort of legislation has decided it should be done. In terms of the sort of feedback that we gather through quite an extensive consultation and engagement process between sort of through November, December and early January, there have been a number of changes. It's been really helpful to have the feedback that we've had. Some of those are set out in the papers that you've got, but also we've attached a full sort of summary of the learning that we gathered together from right across the West Yorkshire system, including colleagues on this call and others in Leeds. I suppose just drawing attention and noting probably some of the main changes, and you can see these on page 9 of your report. We've really emphasised that we will continue to provide as the NHS a comprehensive healthcare service. I think that was one of the absolutely imperative things that many people raised, including colleagues in Leeds. We've also strengthened the degree of independent challenge and an independent perspective on the board of the ICB. Again, I think there was a sense that that was important. We've also strengthened the focus on people and workforce, given the pressures that we experience, not just within the NHS, but more widely across the public sector, certainly in social care. It was felt right that we perhaps hadn't given enough emphasis to the importance of workforce, and therefore there's an appointment of the Director of People and Workforce onto the board of the ICB to give it that focus and attention. Another thing that hadn't perhaps been as clear as it needed to be was that whichever background or whichever group you brought a perspective from, that you were on that board, and it was a unitary board, and therefore you were taking decisions together on behalf of the West Yorkshire system. That's been strengthened and emphasised and been made very clear that this is a unitary board and all members are members of that kind of board, and therefore are not taking decisions on behalf of their individual organisation, but on the collective benefit for the West Yorkshire system. On line of that, we've also extended the representation to a couple of other sectors. I think in the early versions of voluntary, the sector was not clearly established as a key member. It is now. And also we've got a number of big community providers of healthcare across the West Yorkshire system, and they weren't particularly represented. So we've added that onto the membership as well. You can see a more detailed list of the membership, and I'll come back to that in a moment. So those are some of the things that have gone into the constitution. At the same time, some of the other recommendations and suggestions and challenges that came through the engagement process are going into the handbook. The governance handbook is something that is probably more managed by the West Yorkshire system rather than requiring NHS England approval. And that will have a lot more of the detail in. We've used the extension to the 1st of July to do some more work on that and make sure it's well engaged with and talked through. So it's going to the joint West Yorkshire Joint Committee, Overview and Scrutiny Committee soon. And then we will very happily bring it round and share it more widely across the system before it finally gets published and ready for the 1st of July. But what we have done in the pack that you've got, if we set out sort of the key component parts of that, so that you're aware of the kind of things that it will be looking at. And that's where a lot more of the ideas, thoughts that we've gathered will go in due course. That is quite a significant document, and I will want to share it, and we'll absolutely be sharing it more widely. We're just getting that first draft done. I think the deadline is the end of this week, and then it will go to the Joint Overview and Scrutiny Committee, as I said. But it's just worth noting. And I think again in your pack on page 9, it does detail some of those issues that were raised that have gone through, or will be going through into that governance handbook. It's page 10, I think, of the pack also describes the membership of the Icb Board in a little bit more detail. I think it's really important that we remember that the Icb Board is only one part of a complex ICS system. So the system itself has got multiple partners. The ICB sees itself as one of those. It is not over it, it's not above it, it is part of it. And it sits within a sort of complex matrix of different partners within the wider integrated care system. I think it's also really important to note that it's a very different model of what a board would look like normally, particularly for those of us that have worked in the NHS or worked with the NHS. So NHS boards tend to be made up of executives and non-executives. The non-executives are there to hold the executives to account and to make sure the strategy and so on for the organisation is developed. CCG's moved a little bit away from that with a membership model, but not that far away from it. I think this probably goes one step further in that what we are seeing and designing in West Yorkshire is a multi-perspective board. So as it sets out on page 10, there are multiple perspectives coming in there. There are some executives working at the centre of the ICS. There are some place leads, accountable officers, of which I'm one, who have responsibility for making sure the system in their place works effectively. But then there are some independent members. There are also members from provider groups, and that doesn't just include NHS providers. And there's also a council officer and Health Watch and a director of public health. So there are a number of different perspectives that come together. So in the traditional sense of independence and independent members and executives, we've gone slightly beyond that, and I think that's really important to note, and probably is quite exciting. But it presents some other challenges, which we may want to talk about later on. But I just did want to note that. Most of that board is now appointed in terms of the independent members and chair. So Cathy Elliott's the chair, a number of independent members. There's one more independent member still to be appointed, and that will be happening shortly. The place leads are all appointed, and the executive directors of the ICB are also appointed. So Rob Webster and his team. They are a mix of people who've been working in West Yorkshire for a while and a couple of new executive directors. So Bev Geary is a nurse who's been at Hull Teaching Hospital, director of nursing there. She's taking on the role as the chief nurse of the ICB. And then a colleague who is coming in to work with people workforce is actually coming from West Yorkshire Police as their director of people. So a blend, I think, of some new faces and some new ideas with those that are well established and worked in the system for quite a long time. Pages 11 and 12 describe the sort of wider decision-making structures. So going back to the fact that the Integrated Care Board, yes, is an important part of the system, but it is not the only decision-making authority within the system. There are a number of other committees, there are place responsibilities, and I'll talk about those in a moment, but there are also, of course, the Integrated Care Partnership, which is a much broader group of people who steer the work that we do and set the strategy for the ICS, and that includes and is chaired by council representatives. So I think a danger of seeing this change is that we are creating an integrated care board with a very NHS focus that sits and controls the system. What we're trying to do is create a system in which we're very clear about the different functions that different partners play, but there's not that more traditional hierarchical approach. And I think it's been strength of West Yorkshire, the degree of engagement, the breadth of the membership of different parts of that infrastructure, and the way that responsibilities are being delegated to place. In terms of Leeds, so the plan is that each place will have a committee of the ICB. That committee will have substantial delegated powers and substantial delegated financial resources. Currently, through the CCG, about £1.3 billion a year of NHS money comes in to Leeds. The plan is that the vast majority of that, if not all of that, will come into the committee of the ICB, the Leeds committee of the ICB, and be delegated. Delegated through me, but also then overseen by that committee. So it's a really significant committee, really, in terms of managing NHS resource and making sure that's aligned to the health and wellbeing strategy in Leeds and the plans that we've developed locally, as well as having some of the statutory responsibilities of the West Yorkshire ICB. So that committee, we've been working quite hard in Leeds to get that committee in place, to understand its relationships with other partners. We've agreed the membership and we've been appointing to that. We've yet to appoint the chair. We had interviews, didn't feel either the candidates were strong enough or didn't have the right fit for Leeds. So we've gone back out to recruitment and hope to recruit. Well, we've got 6 very strong candidates this time. We're just going through the shortlisting process at the moment, and we'll be interviewing in the middle of May. So we'll have that person in place before the July deadline. We've appointed 2 independent members alongside John from Healthwatch to give us that sort of independent perspective in Leeds. And we have the executive people who, myself and others who work for me, and our partner at Leeds as well, all in place. So we've been meeting in shadow form for a while now, and we'll continue to do so right up to the July meeting. I guess the sort of key responsibilities of that committee are ensuring that we deliver the statutory duties of the ICB in Leeds, which are around quality, outcomes and finance. Making sure that we invest in line with our strategies and plans across West Yorkshire and in Leeds, and that we continue to develop the level of integration and partnership working that we'd want between healthcare providers, the voluntary sector and the local authority, as we have been doing for a number of years in Leeds. But we want to keep that focus and that sense of movement going forward. In terms of other changes within the Leeds system, in one sense, nothing else needs to change. We may be changing things, we may be giving different committees and boards sort of different names, but that's part of an evolution journey that we were on already. And I just touched on, I think, when I came to see you in January. That continues. And I think it's really important, given the size of our city, the breadth of the challenges we face, and the depth of experience and expertise that we've got across all our public sector and voluntary sector partners, that we continue to make sure that we distribute the leadership and responsibility for different areas as widely as possible. So that's the sort of thinking behind how that committee in Leeds will work. But that's the way we've worked in Leeds anyway. That's just continual evolution of how we see the world and how we do things. In terms of the interviews for the chair and the independent members, probably just sort of say Councillor Venner was the chair of the panel appointing the independent members and was also on the panel appointing the chair. Sue Proctor, I think, from LYPFT was chair of that. Oh no, it was Kathy Elliott, sorry, was chair of that panel, Kathy from the ICB. So we've had quite an inclusive process. The local authority have certainly been involved in the appointment process, as have our NHS partners and the CCG and the voluntary sector as well. So I'm not going to say a lot more. I think it's probably want to open it up to people. I can obviously give a lot more detail about both Leeds and West Yorkshire. Well, I suspect that conversation is probably where we ought to go next. So I'll hand back to you, Councillor Cotton.
Thank you very much, Tim, for that summary. Obviously, I have been in meetings with you at the West Yorkshire level, so I do know a lot about what you have just explained to us. So we are now open to ask team questions. Members, Councillor Fenner, first hand up.
Thank you, Chair. I just wanted to add some comments really to the comments that Tim's made. One of the areas that I've been particularly interested in, because I chair the Health and Wellbeing Board, is the links between the Health and Wellbeing Board and the Place-Based Committee. And actually, in the legislation, that's quite a weak point. There's not like formal accountability in really. But the document, the diagram that's in one of the appendices of the reports that you've got sets it up very well the way we're planning to proceed in West Yorkshire, because we're really clear that the Health and Wellbeing Boards in each area should set the vision for health and wellbeing for the area, and then that's what the Place-Based Committee would implement. But actually that's not set out that clearly in the legislation. And in terms of accountability between the Place-Based Committee and the Health and Wellbeing Board, that's really reliant on relationships, which feels positive and fine in Leeds because we have really good relationships, and the senior leaders of the health and care system all sit on the Health and Wellbeing Board. So Tim, the chief execs of the Teaching Hospitals Trust, the Mental Health Trust, the Community Healthcare Trust, all the senior leaders are on that board, and it feels like that's where the accountability will be. But it is, I think it's a weakness in the legislation, but we've addressed that through our constitution, and hopefully that's clear in the documents you've got, that there'll be a really strong link between the Health and Wellbeing Board and the Place-Based Committee. It's a really interesting point about elected members not being on Place-Based Committees, and I think this is outlined in the papers that you've had, that we've gone backwards and forwards a bit on that, because initially people certainly in West Yorkshire were talking amongst ourselves about whether we thought elected members should be on the Place-Based Committee. Then it seemed like the legislation actually was prohibiting that, and then that was amended slightly. But I think most people in West Yorkshire have chosen that most of the people involved in the structures in West Yorkshire have chosen that elected members are not on the Place-Based Committee. And for me, that was quite a finely balanced decision on whether I was going to argue to sit on it or not as the chair of the Health and Wellbeing Board. But actually, I think it's better that the political leadership is at the Health and Wellbeing Board level and has a slight kind of separateness and isn't a member of the Place-Based Committee, although, as I've already said, there'll be a really strong link. And then the Partnership Board, the West Yorkshire Partnership Board, I completely lost track of what it's going to be called, currently called the Partnership Board. It is politically led. It's chaired at the moment by Councillor Tim Swift, who's the leader of Calderdale. So that's where the kind of political leadership is in the system. As Tim's outlined, there's a really strong focus that's continued in this new structure around the voice of the community and the voice of individuals in the community. So there's a really strong third sector and Health Watch presence in the structure. We've got the allyship programme of the Health and Wellbeing Board, which is amazing. I'm really proud of it, and I'm loving my own allyship partnership. So everybody who sits on the Health and Wellbeing Board, and bearing in mind this is incredibly senior people, they're all paired with a third sector organisation that works in the area of health inequalities to do a piece of work around health inequalities. So I'm paired with the Gypsum Traveller Exchange. Thea, who is the Chief Executive of Community Healthcare Trust, is paired with PAFRAS, and she was talking to me about doing a PAFRAS drop-in, giving out food parcels to refugees and asylum seekers. So I think it's really positive in terms of people that are very senior leaders who, if they were practitioners, it was quite a long time ago, getting sort of back on the front line really with some of these really grassroots organisations. So through both the Health and Wellbeing Board and the new place-based committee, we have that really strong focus on the third sector, on citizens and their voices. I've mentioned before, we've talked about the new structures and the legislation. As a politician, one of the concerns that's been raised most with me, which probably isn't a surprise to people, is whether this represents risks around privatisation of the NHS. And hopefully you've noted that in the Constitution that you've had in the papers, the fact that private sector providers are not on the place-based committees is very much strengthened. It's one of the red amendments that was shown in the document, kind of highlights the fact that's not going to be the case here. Those are just the comments I wanted to add, Chair. Thank you.
Thank you very much, Councillor Venner. Very helpful. Tim, do you want to give us some comments on that, please?
I think the importance, certainly in Leeds, but also across West Yorkshire, of the Health and Wellbeing Boards is recognised, acknowledged, and I'm really pleased it's written into our constitution and into the way that we work in Leeds. I think the annex was Annex 5, it's page 102, and I think it's a really helpful diagram to describe the West Yorkshire system and where Health and Wellbeing Boards sit in that. We'll continue, and once we appoint the chair of the Icb committee in Leeds, I would hope that they, become, instead of perhaps the CCG chair, a representative on the Health and Wellbeing Board as well. So we keep that really strong, tight link there. I think the other thing is on the sort of keeping in touch with the communities and involved and so on. I love the allyship programme. I'm allied to the Hamara Centre. And what's really good that's come out of that is that Shanaz Gal, who's the sort of managing director of the Hamara Centre, is the voluntary sector person on the Leeds committee of the ICB, and felt confident to put herself forward, which I don't know that she would have done before. That not only gives us that sort of grassroots feel, but broadens the perspective of the committee, I think, really strongly. And on that, we've also got one of the independent members that we appointed, someone called Yasmin Khan, currently works in Bradford, but has worked at sort of national level, and also lives in Leeds. And again, brings a voluntary sector and community voice. So I think we've actually strengthened the system in Leeds from an NHS perspective, because we didn't really have that anywhere in the way that we've now got it. So that's probably a step forward, if anything.
Okay, thank you very much. Have we got any other questions or comments for Tim? Yes, Dr. Beale.
Thank you, Chair. Just to start with, and we've said it before, but I think it's important that we reaffirm it. Very pleased to see that people's voices is at the centre of the policy making, and particularly, of course, from a Health Watch point of view, the recognition that the local Health Watch in each of the place areas is a statutory body, and not the only source of people's voices, obviously, but a statutory voice of people. I was very pleased to see.
Dr. Beale, you've muted yourself accidentally. Still muted. That's it.
I'll try not to touch the screen again.
Sorry.
Very pleased to see the Workforce Director as part of the board. I think that's an excellent way forward. The other point I want to make, it's really 2 points, but can I first declare an interest, not a commercial interest, not a financial interest, but as I think most of you know, I am a retired consultant in dental public health. And I did notice that one of the people who responded to the consultation did suggest that a dentist was a member of the board, and that clearly wasn't taken up. It wasn't me, by the way, but and I don't know who it was, although I have some idea of who it might have been. But that brings me to another question. It was very clear from our discussion last month that dentistry has really become more and more semi-detached from the NHS. And my personal view, and I know others that do share it, but maybe not everyone, that dentistry should be more integrated with the main part of the NHS, rather than being a sort of semi-detached part of the health service, which raises the question as to where dental services, primary dental care, is going to be commissioned. At the moment, it's with NHS England at the, what one might call the regional level, at Yorkshire and the Humber. It will presumably come to West Yorkshire level, but we know from what Tim has said and what we've heard before, that many of the commissioning aspects are going to be delegated to the place-based committees. I think it's quite important that bodies like this Scrutiny Board do know where the various services are commissioned, so that they know who to turn to when they have questions about a particular service. That includes dentistry. And I would argue that whether it's West Yorkshire or whether it's place-based, and I understand that no one wants to do it really, it's a nightmare service to commission at the moment, and many of the things which would improve dental care can't necessarily be done at a place level, even a West Yorkshire level. It needs to be tackled at a national level, but nevertheless, it's got to be commissioned from somewhere. How will the decision be made about which services West Yorkshire will keep and which services they will delegate to the place level? Thank you, Chair.
Thank you very much, Dr. Bill. Very pertinent questions. Back to you, Tim.
Okay, so picking up the public voice, thank you, John. I mean, I do think it's a strength of West Yorkshire, and it's a particular strength in Leeds. And it's great to have you on the committee, the Leeds committee. And you know, the work we've done around people's voice in Leeds is strong and well known and understood, and it will continue to play an important part. And one of the subcommittees that seek assurance on behalf of the system, we've deliberately named quality and people's voice, because we want to make sure those are clearly tied. It's not just a traditional view of NHS quality, but bringing that experiential feedback into that loop. So that I think is positive. In terms of dentistry, during this current financial year, it will remain with NHS England. We did have the option to take it back immediately, but as you've indicated, there are lots of concerns about where we've got to in terms of dentistry and commissioning, and we want to do a bit more due diligence as a West Yorkshire system in advance of doing that. We are expected to take it back to West Yorkshire level at least for next April. You know, I fully agree with you that it has become detached. I think those things that have been commissioned by NHS England separately have generally become detached from the rest of the health system. So there is a strong opportunity to bring that back in. There will be work done over the next 12 months or so to make decisions about how best to commission that within the West Yorkshire system, whether that's one centre or whether that needs to be played back into place. I think my natural sort of philosophical mindset is to argue very strongly it needs to come back to place and be linked into all the other parts of the system at a place level. It is something very local. That's how I see it. I think that's, however, I would caveat it with the concerns about the resource that will come from NHS England to do the job, alongside some of the very significant challenges there are, which, as you've rightly said, can only be addressed at a national level. One of the things we may be wanting to consider as a West Yorkshire system is what pushback we put in place to really challenge NHS England and the department to review make some of the necessary changes at a national level before they pass it down to places. And that's quite a live conversation at the moment, because frankly, if it just gets passed in the current state with the current restrictions on what we're able to do, I think we will struggle to do any better than has been done so far. But this is an opportunity to make a case for doing it differently. The other option is we're allowed to do it in some sort of very different pilot. We have some ideas and plans. So those conversations are live, and it will be probably from next April that the West Yorkshire system takes that on. Very happy. I'm sure at some stage we can come back and talk to you about where it's likely to land and when in a bit more detail.
Okay, thank you very much. That's helpful. Councillor Latty.
Thank you, Madam Chairman. I think, in a sense, it's rather a shame. I'm going out on a moaning note, so to speak. But last time I raised the question of the size of the board, and it would appear from the papers that we were talking about today that I wasn't alone, that this was quite a popular response, as you might say, the size of the board. But anyway, you know, it is what it is, and we can't do anything about that now. But I do, again, last time I raised this question of what I call the gatekeepers of the NHS, the general practice, and it does seem to be such a shame and such an omission that when we are trying to improve and produce this integrated care system, which fantastic idea, and we cannot not be behind that. But the people who feed the patients into that integrated care system are beyond control, and I just think that this is an immense weakness. And I don't feel from the way things are going at the moment that general practice is climbing out of the hole that it got itself into. And well, I won't say any more, because I say it sounds a bit like a moan. I suppose it is in a sense, but it's a pity that that the integrated care system can't integrate the road in as well as what happens when you're in. Okay.
Thank you, Councillor Latty.
To respond. So I think there probably 2 or 3 things I can respond on that. I think we're making progress involving general practice much more in decision making across both Leeds and indeed the West Yorkshire system, and they've certainly got a place at the table in all our committees and boards within Leeds. And so I don't want us to be overly pessimistic about the opportunity we have to bring them into the system rather than see them sat outside the system. We would view it, and they are chomping at the bit to make sure that we view it this way, that they are part of the system, they want to be part of the system, they are nervous that they're going to sit outside it, and we're really keen that they don't, and they're very keen that they don't. So both within the Leeds structures and the West Yorkshire structures, they are an integral part of what we're doing. I think then there's probably 2 other challenges that we face. One is the very model of general practice, which of course each GP practice is a private provider in its own right. It's an independent contractor, that's the nature of them. There's a contract with them that's set and negotiated nationally that we then operate. So our room for manoeuvre in that respect is somewhat limited, a little bit like it is with dentistry. However, most of us have got to the point where there are a variety of more local schemes that we work with general practice that we are able to use to bring them in and encourage them to participate in a different way. So it's not entirely resolving the issue of that independent nature of general practice that's been there right since the formation of the NHS. But nevertheless, it help mitigates that. And we will continue to do that both within Leeds and within West Yorkshire. I think the third challenge is the workforce challenge. I mean, there's a known gap of probably 5,000 GPs. If anything, it's getting worse. It's not going in the right direction. Leeds is relatively well provided for, partly because we have a medical school in Leeds, and therefore people end up in practices near where they train quite often. But that gap in workforce remains a significant problem. It's not just in general practice, it's elsewhere in the NHS and indeed social care, as we've discussed at other times. But that gap of 5,000 GPs across England and worsening is not conducive to delivering the kind of service and opportunity we would want to see, and indeed GPs want to deliver. So when we hear the stories, and we do, and I hear them regularly, anytime I open my mouth and say I'm an NHS manager, I get them of, oh, I can't get hold of my GP. I think the assumption is GPs are not doing anything. The simple clue is that GPs are probably the most, increase their productivity beyond any other part of the economy. But nevertheless, there are still not enough GPs to meet the level of demand. One in 3 people every month, equivalent of the residents of Leeds, consult their general practitioner and have a consultation in some form with them. So given that sort of size and scale, gaps in the service are inevitable when your workforce and it takes 10 years to train GP. So this is not a problem that's being resolved or being resolved quickly. So yes, there are some challenges, undoubtedly, and it's not an easy world to work in. It's complex and involves, but I don't want us to be entirely pessimistic. General practice is at the heart of our plans. It is contributing, and I think will be something that we continue to build on, particularly in things like localities and local care partnerships aligned to the primary care networks, are actually in some parts of Leeds doing a really, really good job at bringing a sort of wider perspective on health and healthcare together with partners in the city. So yeah, recognise some of the challenges, definitely, Councillor Latty, but I don't want us to be completely pessimistic about how much we can do with them. That's all right.
Thank you, Tim. Councillor Latty, any supplementary questions? I don't want you to have your last meeting moaning.
No, I'm quite happy with that. Thank you.
You're happy with that? Excellent. Okay. I would like to ask Kath, sorry?
I say Tim has gone some way towards making an old man happy. Right.
Oh, that's good.
Thank you.
All right. I'd like to ask Kath or Victoria if they've got any comments to make for us.
Thanks, Chair. Oh, sorry, I didn't know who was going first there, Kath. Shall I just jump in briefly? Thank you for the opportunity. Really just a couple of short points really to emphasise the comments that have been made by Tim and Councillor Venner, specifically around how we have built our local system to really strengthen those relationships across the city and going much more beyond the national requirements for that. So that does feel incredibly positive. It reflects absolutely how we work already. I think the risk with it is that if we don't proactively make that work, the default position is that it's not a statutory requirement. So it's very much up to us as local leaders to make that work and also sort of see some tangible benefits from those enhanced arrangements, so we can actually point to stuff that we've joined up better because we have those things in place. So I think that feels incredibly positive. I'd like to support the comments made about it, but it's almost kind of up to us now to make that work in practice, given all the absolutely real challenges we have coming through COVID and the level of partnership work which will be needed to really turn around some of the health outcomes that at the moment are heading in the wrong direction. So the challenge is great, but I think we've got the right mechanisms in place as have been described. That's really positive. And building on that, I think the other point is just that level down in really thinking about how we do join up. It's a very complex system, isn't it? And Tim's taken us through the complexities of the ICS arrangements across West Yorkshire. We're a big city that has, multiple layers of partnerships already. So I think the getting into some of the detail around what this means for your really specific programs of work and how we can simplify and streamline them as much as possible, so we don't have a super complex, multi-layered, system of 8 meetings for one issue, and because there's a danger that that's what happens within this new system. So I think, again, to challenge ourselves around very specific work areas. We've got the development around Leeds becoming a Marmot city and doing additional work around health inequalities, which mainly is focused on those things that we can do outside the health and care system that make a difference to health, which we will lead on across the city. They need to join up with all the work that Tim's describing around all the work that's been led from within the NHS around health inequalities, so we don't have a kind of twin track approach to the work we do. So I think it's that there's so much appetite to do so much. I think our job as system leaders is to try to make sure that's kind of really well connected and very and as easy as possible for people who work in the system, but also the citizens of Leeds to make sense of and understand. So I think there's lots of work to do there, but it feels like we're the way that we're becoming established will set us in the right direction. So thank you, just to make those brief comments.
Yeah, thank you very much, Victoria. And it's quite great to hear. I mean, you've just mentioned our inclusion is actually our choice, and the effort that we are making as a city and as a council, in making that happen. So that is very, very welcome. And thank you very much. Kath, over to you.
So it's quite interesting for social care. I mean, we're clearly part of an integrated system and want to be, but I'm very clear that I'm still accountable to elected members and to the Executive Board, while still playing a role in the governance of a new integrated care system. We might not have a legislative responsibility or accountability, but certainly as a system partner, we hold ourselves mutually accountable in that integrated system. And I think we're still working through how that looks and feels in practical terms. I think Leeds is very clear about the sort of strategic shift we want to engineer for health and care services, moving care closer to home, having a big focus on prevention. And I think our ambition is very, very clear. Obviously, the challenge, as ever, will be delivering that. So I think this presents us an opportunity to do that at pace, alongside huge complexity in the system and social care reform that will be put in place over the next couple of years. So I constantly feel like I'm looking 2 ways in terms of navigating where social care lands in this system. But we've had really positive conversations, and I genuinely think we sit within the best ICS in the country. I compare notes with colleagues who work in other systems, and it's nowhere near the calibre of the West Yorkshire ICS. So I think you have to sometimes step out of your own system to make you appreciate how mature and ethical is the system that we've designed in West Yorkshire. So I always feel if it can happen anywhere, it can happen in Leeds and it can happen in West Yorkshire.
Thank you very much, Kath. That's very comforting. Right, members, any more comments? Any more questions? Good to see you, Councillor Dowson. You're welcome. I did miss you. I didn't get so many questions this time. That was how I knew you weren't here.
Yes, my apologies. I will save all my questions till the meeting next week. So,
that's very kind of you. Thank you.
But I have read the papers, and
right.
I agree with Kath, because I think we have to compare ourselves, don't we, with how things happen, and we often don't look at what's happening across the sort of core cities. And I do appreciate everything we're doing in Leeds. And that includes the work you do, Abigail, with the Scrutiny Board, holding everybody to account.
Thank you very much, Councillor Dowson. Okay, thank you very much, Tim Riley. Do you have any other thing you would like to say, or are you happy for us to move on?
Happy for you to move on, but I'm always happy to come back and talk about this, or indeed more of the detail in Leeds in due course, or indeed, as I've said, dentistry, for example, later.
Definitely, yeah. So thank you very much for all your help with this. And just to let the board know that this discussion will be acknowledged, and the intention is actually to bring a further report on the latest position of the ICS, and that will be at the first meeting of the new successor Scrutiny Board later in June. So thank you very much for that. I will now hand over to Angela to go through our work schedule for us.
Thank you, Chair. So this report presents the latest version of the board's work schedule, which is set out in Appendix 1 for members' consideration. Within this, you'll note the intention to hold a visit to various active Leeds facilities during May, and the date of this visit is now being confirmed as Monday, 9th of May. And the members attending this visit includes Councillor Marshall-Catone, Councillor Gibson, Councillor Anderson, Councillor Taylor and Dr. Beale. So final arrangements are still being put in place, and so should any other members wish to attend, then if you could let me know as soon as possible, please. As this is the board's final scheduled meeting of the municipal year, board members are also requested to consider and discuss the draft work schedule of the successor Scrutiny Board for the next municipal year. So the drafted work schedule for next year is set out in Appendix 3. And this includes proposed meeting dates. It also includes known items of scrutiny activities such as performance and budget monitoring, as well as other identified areas that this board has already recommended that the successor board pursues in the new municipal year. And then paragraphs 5 to 9 of the work schedule report also references the recent publication of a final report of the independent review known as the Ockenden Review of maternity services at Shrewsbury and Telford Hospital NHS Trust. So linked to this, it was also suggested that the successor Scrutiny Board, we recommend that we utilise the July meeting to receive a report on maternal health provision in Leeds. And in doing so, this could include an update on the Leeds maternity strategy work and the current position on the Leeds fertility IVF service work that the board looked at last year, and also the implications of these review findings and how any recommendations are being taken forward across our local maternity system in Leeds. So I'll pass back to you now, Chair. Thank you.
Thank you very much, Angela. Okay, just before we conclude, I will just like to let all of us know that one of our very long-standing members, Councillor Graham Latty, it's his last meeting today. We've just got a little summary about him for those who do not really know him, or for those who are quite new to the board. So, like I said, Councillor Latty has been a long-standing member of this Scrutiny Board, and he will be retiring from the council in May. Councillor Latty was first elected to the council in 2000, representing the Aireborough ward, and now called Guiseley and Rawdon ward since 2004. Councillor Latti has given a total number of 22 years service as a local councillor and representing his constituents. During that time, he has held a number of roles, including being a long-standing member throughout his 22 years and representing this great city of Leeds as Lord Mayor in 2018 to 19. He first joined this Scrutiny Board in December 2014, and apart from his year as Lord Mayor, he has been a member of the board since that time. As fellow members, we know the time, effort, and dedication that's needed to be a member of this Scrutiny Board, and we are grateful for all his efforts and contribution to the board's work, and also that of the West Yorkshire Joint Health Overview and Scrutiny Committee, which both of us sit on. So on behalf of all members of this board, past and present, Councillor Latti, we would just like to say a very huge thank you to you and wish you every success as you retire and every good luck in all that you do. From the bottom of my heart is thank you from all of us. Please do give him a virtual clap. We can't hear you, Councillor Latti. You're muted.
I said thank you very, very much. And do I have the right of reply?
Of course you do.
Well, you've summed it up very, very nicely. 22 years in which, yes, 2014 on this board, but I was on sort of different models of it prior to that. And my whole time really seems to have been spent between health and planning. I've been a member of City Plans for about 16 of those 22 years. And this, as I say, a long time. I've enjoyed every minute. That might sound like an exaggeration, but I really have enjoyed it. And I'm going to miss the people that I've met and known. And the lovely thing about this board is that it gets your fingers out into the real world, doesn't it? You know, it's not just sitting here and talking about it. You do actually get involved and get your fingers into what's really happening out there. Unlike some aspects of the council, which is a bit like, you know, sitting in an ivory tower. There's no ivory tower in health. So all of you, all the people I've met, to the officers particularly, I've had some lovely relationships with officers, and I'm one of those councillors who, I don't mean I'm particularly different, but I've always felt that, you know, get on with officers and you'll have a damn sight better life. And that's very, very true. It's also a deeper life. You get more into the nuts and bolts. So thank you to everybody, councillors and officers, and NHS members. Thank you very much for making my life that much better over the last 19 years. Thanks a lot.
Oh, thank you very much, Councillor Latti, and we will miss you too. I can see Dr. Beale has got his hands up quick. You got a poem for him?
Thank you very much, Chair. I mean, first of all, I'd just like to endorse everything you said about Councillor Latti. He's one of the few councillors who's been on this board ever since I joined, and so it's really nice to see him still there. But sadly, when we meet next month, he won't be. Can I also take this opportunity of thanking you as Chair for the way you've chaired this board? Personally, I hope that you are still the chair if I'm co-opted again next year, but maybe you'll be moving on to bigger and better things. But thank you very much for the way you've chaired this board over the past period of time.
Thank you very much, Dr. Bill, for your kind words. And to all the officers, we couldn't have been able to achieve and be where we are without each and every one of you, Kath, Victoria, Angela, Stephen, Becky, all the back office staff at the Civic, you know, for all your hard work behind the scenes, exec members, Councillor Arif, Councillor Venner, each and every member of this board. We just want to say huge thank you for your time, participation. You know, I mean, everyone is busy right now, but we're all here today, and that's because we've got the community in our hearts. So on behalf of the board again, we just want to say another huge thank you, and wishing everyone good luck as we go back onto the campaign trail. And hopefully, the thing is, with health, everything stops, but health doesn't stop. hospitals will have to keep running, doctors will have to still work, nurses will have to still work. So our job still continues. So thank you all so much. Is there anything anybody would like to say? Fantastic. Forever hold your peace until we come back in May or in June. So thank you all very much. Have a lovely afternoon. Those of you joining us in May, it's May the 9th. So we would send out a confirmation anyway in terms of meeting points and how we would take up. So thank you all very much. Have a lovely, lovely afternoon. Look after yourself.
Thank you, Chair.
Thank you.
Bye.
Thank you. Bye.